A 42-year-old woman sits down to dinner. She takes a bite of grilled fish, feels a sharp prick at the back of her throat, and panics. Her mother always told her, swallow a big spoonful of rice to push it down. So she does. The pain disappears. She forgets about it. 7 days later, she walks into an emergency room with a high fever, chest pain, and the worst chills of her life. Doctors run a CT scan. The fishbone is no longer in her throat. It's buried 1 centimeter deep inside the back wall of her heart. I'm Dr. What Happens. Today, I'll show you exactly how a single bite of fish ends up in a beating human heart. The reason a fishbone is so dangerous isn't the throat injury. It's what happens after. A fishbone is thin, sharp, and laced with bacteria from your mouth. When it lodges in the esophageal wall, 3 things start working against you at the same time. 1. Mechanical perforation. The point pierces the mucosa directly, especially at the 3 natural narrow spots, the upper esophageal sphincter, the spot next to the aortic arch, and the pylorus. 2. Peristalsis migration. Every time you swallow, your esophagus contracts in a rolling wave. That wave pushes against the bone, driving it deeper into the wall, then through it into the mediastinum, the central compartment of your chest that holds your heart, your aorta, and your trachea. 3. Bacterial spread. The bacteria from your mouth ride the bone into deep tissue, triggering acute infection and granuloma formation. That infection alone can kill you. The early symptoms are deceptively mild: a sore throat, painful swallowing, a foreign body sensation, retrosternal pain that gets worse when you breathe in. The late symptoms are catastrophic: high fever, chills, difficulty breathing, crepitus, a crackling feeling under the skin of the neck or chest because air is leaking from the perforated esophagus. And in the worst cases, hematemesis, vomiting blood, when the bone reaches a major vessel. Now, here's what almost every emergency department in the world sees: patients arriving days late because they tried the folk remedies first. 2 folk remedies. Both are absolutely forbidden: swallowing rice, swallowing vinegar. Both of them will make this worse. And in the next 2 cases, you'll see exactly how much worse. Case 1. The 42-year-old woman. After a week of fever and chest pain, the CT scan found something almost nobody expected. The fishbone was gone from her esophagus entirely. It had migrated forward, all the way through her chest, through her pericardium, and the 3-centimeter bone was now driven 1 centimeter deep into the back wall of her left atrium, the upper chamber of her heart. Pus had already filled her pericardial sac. She had pericarditis, mediastinitis, sepsis was coming. She was rushed into emergency open-heart surgery on cardiopulmonary bypass. Surgeons cracked her chest, stopped her heart, opened her left atrium, pulled out a sharp 3-centimeter fishbone from inside the heart muscle, washed out the infected pericardium, and sutured the hole shut. She survived. She survived because someone, somewhere, ordered the CT scan. The rice she swallowed 7 days earlier didn't push the bone down. It pushed it forward, through the wall, into her heart. Case 2. A 64-year-old man eats grilled fish for dinner. He feels a little chest pain and trouble swallowing. He thinks it'll pass. 4 days later, he's coughing up small amounts of blood, what we call sentinel bleeding, the warning sign before catastrophe. He goes to the ER. The CT shows a 2.5-centimeter fishbone that has tunneled out of his esophagus and is now drilled directly into the wall of his aortic arch. A pseudoaneurysm has formed around it. The bone is the only thing plugging the hole in his largest artery. As doctors prepare him for emergency surgery, his blood pressure shifts. The bone slips. The aortoesophageal fistula opens. He vomits liters of bright red arterial blood in seconds and goes into hypovolemic shock. CPR, emergency thoracotomy. He doesn't make it. 3 rules that could save your life tonight. 1. If you feel a fishbone stuck and the pain doesn't resolve in a few hours, go to the ER. Not urgent care, the ER. Demand a CT scan because X-rays miss most fishbones. 2. Never swallow rice, never swallow bread, never drink vinegar. These remedies don't push fishbones down, they push them through your esophagus, into your mediastinum, into your aorta, into your heart. 3. If you ever cough up even a small amount of blood after a fishbone incident, even days later, call 911. That is a sentinel bleed. The next bleed kills you. Next week, what happens when a magnet ends up in a child's intestine? Subscribe to Doctor What Happens.